Crohn's disease by Catherine, Hope, and Kirsten. Sue is a 30-year-old female who has been recently diagnosed with Crohn's disease. She came to us as nurses to educate her on the disease. Crohn's disease is an inflammatory bowel disease that disrupts the body's ability to digest food, absorb nutrients, and eliminate waste. Risk factors that could have increased Sue's chance of being diagnosed with Crohn's disease include age. If under the age of 30, you are at higher risk of developing Crohn's disease. Cigarette smoking. Smoking cigarettes is the most controllable risk factor for developing Crohn's disease. Ethnicity. Although Crohn's disease can affect any ethnic group, whites and people of Eastern Europe descent have the highest risk. Family history. You're at higher risk if you have a close relative, such as a parent, sibling, or child with the disease. Physiology. The GI tract is a continuous muscular tube that winds through the body from the mouth to the anus. It digests foods and absorbs nutrients into the blood and lymph. The GI tract is composed of the mouth, pharynx, esophagus, stomach, small intestine, large intestine, and anus. Food is taken in at the mouth and travels down the esophagus to the stomach. Once in the stomach, food is mixed with acids and enzymes that break it down into small pieces called chyme. The food then travels to the small intestine where it is further digested and nutrients is absorbed. Digested nutrients pass into the blood vessels in the wall of the intestine through a process of diffusion. Food is moved through the GI tract from small intestine to large intestine via peristalsis. At the large intestine, water and salt from the stool are extracted and feces is stored until being expelled from the body via the anus. Pathophysiology. Inflammation from Crohn's can strike anywhere in the GI tract, but it usually occurs in the lower part of the small intestine or the upper part of the large intestine. It is important to understand that the GI tract is full of normal intestinal bacteria that support digestion. The immune system is unresponsive to these normal bacteria, but is always ready to respond against unknown ingested pathogens. In Crohn's, this normal state of homeostasis is disrupted, which leads to an unrelated and exaggerated immune response against the normal bacteria. Immune cells move out of the blood to the intestine and produce inflammation. During this process, chemicals such as histamines, bradykinin, and prostaglandins are released. This release of chemicals leads to increased blood flow to the area and increased permeability of capillaries, which causes swelling and narrowing of the blood vessels. Increased permeability allows attracted leukocytes to enter the affected tissue, which leads to phagocytosis and the breakdown of pathogens. Once intruders are destroyed, inflammation settles down. However, in Crohn's, inflammation does not subside. This leads to chronic inflammation, ulceration, and the thickening of the intestinal walls. Symptoms that Sue can expect to encounter: diarrhea, fever and fatigue, abdominal cramps, weight loss, loss of appetite, and rectal bleeding. Ulcers cause breaks in the lining of the intestine due to inflammation. They then become larger and deeper, which brings swelling of tissue and abdominal pain. This leads to fever. Ulcers can further penetrate the wall and affect nearby structures. This can lead to weight loss, diarrhea, and decreased nutrient absorption. Scarring can then occur and cause intestinal stiffness, narrowing of the intestinal wall, and rectal bleeding. After time, the bowel wall becomes thickened and inflexible. There are a combination of treatment options that can terminate the inflammation responses and promote healing. However, there is no cure for Crohn's disease. One treatment option is medication. The goal is to reduce the inflammation that triggers your signs and symptoms. This improves long-term prognosis by limiting complications. Medications include anti-inflammatory drugs, immune system suppressors, antibiotics, and other medications. Nutritional deficiencies are common in Crohn's disease due to diarrhea and malabsorption problems. A nutritious diet that is high in calories, vitamins, and proteins is recommended. These diets are largely absorbed in the jejunum and allow the inflamed bowel to rest. An intravenous solution consisting of glucose, amino acids, and fats may also be used as nutritional therapy when food cannot be absorbed from the intestine. If treatment options mentioned are unsuccessful, the doctor may recommend surgery. This would include removing the damaged portion of the digestive tract and reconnecting it with healthy portions. Surgery may also include closing fistulas or draining an abscess. If necessary, the surgeon may also widen a segment of the intestine that has become too narrow. Key concepts: homeostasis in Crohn's disease. Chronic inflammation causes ulcers that break the lining of the intestine. This disrupts homeostasis by causing swelling, scarring, stiffness, and narrowing of the intestinal walls. Proteins. The immune system is composed of proteins that normally protect the body from infections and foreign pathogens. Cell membrane in Crohn's disease. The epithelial tissue becomes hardened and inflexible, not allowing nutrients to pass through. Sue now understands a little bit more about Crohn's disease.